immune system because of his cancer treatments, so that he really can't fight it off. And right now, Josh is in critical condition in the intensive care unit at St. Jude's. I'm looking at these pictures, it just breaks your heart to say he is in heart failure and he is in kidney failure. Now, I know you think, all of us think, why can't they just give this little boy this drug? And it's something called compassionate use. When a drug is being studied, a company can give it out, but it does mean that the company, have to pay for the drug. It means that they have to use resources to distribute the drug, and this company is now saying no. And so I want to introduce you to Josh's mom, Amy Hardy, who joins us from Memphis. Amy, we have been thinking about your family all weekend, and we are really hoping that Josh, that his health situation is going to improve. Can you tell us, what do you think is going to happen if he doesn't get this drug?
As a mom, it's hard for me to say that in words. I mean, you never want to think about that type of thing happening to your child, but we really feel like if he doesn't get it, it's a very good possibility that he will succumb to a virus. I mean, actually, Josh's history, he's actually fought cancer 4 times, and technically has survived each one. Has gone on to be disease-free, no evidence of disease, and now for this virus to be in his system, and there is a drug company out there that has it. They're actually running clinical trials, and the fact that they say that we can't have it is absolutely infuriating to me. It breaks my heart that the parent, I don't have any control over what my son gets, and how he can really just make a full recovery. We want him to play baseball again, and basketball, and just play with his brothers. We all want to be in the same household again. It's just unimaginable that they have what we need and they won't get it to us.
Amy, we reached out to the drug company called Chimerix to ask them that question. Why won't you give Josh this drug? And we offered to have them on this program, and they declined. But they did send us a statement, and so I want to read that statement and talk to you about it. So what they said in the statement is, there are really no words to express our compassion for what this young boy and his family are going through. As a small company with limited resources, we made the difficult decision 2 years ago to end our compassionate use program and focus all of our efforts on earning FDA approval for brincidofovir. This is the only path to making brincidofovir widely available to those who need it in the fastest manner possible. And that's from Kenneth Mock, their president. And Amy, I know your husband has spoken to Mr. Mock. I know that you've heard his side of this, and he says, look, it's $50,000 a patient. We give this to Josh, it's $50,000. Hundreds of patients want this drug. It would delay our ability to get this drug on the market. We want to get this drug available for everyone. It would delay other people's treatment if we give it to Josh and to other people who want it now. What did you and your husband think when you heard those arguments?
Honestly, I just feel like it could be overcome. I mean, there's no good excuse for us. There's nothing that they can say that will really keep us from asking. We're begging them to give it to us, and it all sounds well and good on paper, but I just feel like, especially, here's the opportunity. Seems like the world is watching. Great publicity for their product, and Josh could make a full recovery, and they could be like a real life superhero for a 7-year-old boy. And none of that matters to me, what their excuses are. I feel like where there's a will, there's a way. And honestly, I feel sorry for every family that's in this condition that are begging for this drug, and they continually to say no.
Deb, we want to bring you back into this. I know that you as a mom, you're hearing this story. It's just heartbreaking.
No question about it. One thing I'm curious about, the company decided to end its compassionate use policy. Would that jeopardize any potential approval by the FDA? Is this one of those things where if they give it prematurely, then what they've got in play could ultimately be denied?
The way it works is that drug companies are allowed to give out their drug under this compassionate use program. They're allowed to do it as often as they want. They're allowed to not do it at all. If they give it out, they do have to report how that patient did with the drug under the compassionate use program. But it really is, the FDA kind of handed it over to the drug companies and said, you do what you want. You approve what you want, you deny what you want.
So, which is rather incredible that they didn't explain specifically why they're not giving this medication out for compassionate use. And Ms. Hardy, how do you explain this to your son? What are you telling your son? He beat kidney cancer with his bone marrow transplant. I'm sure his sort of young life has been sort of a series of hospitalizations. What are you telling your son?
You're right. He actually beat kidney cancer, and then he actually had a secondary diagnosis called myelodysplastic syndrome that was as a result of the treatment that he had years ago. And that was the bone marrow to treat the bone marrow, to treat the myelodysplastic syndrome, MDS, we had to get a bone marrow transplant. And I really can't put it into words to him. I really don't even like to talk about it. I know that he is aware because we are in the room when we were trying to push forward and try to convince Merrick's to make this change. I'll tell you the truth, he's so weak and frail that conversations are pretty limited with him. He might say a few words and then he falls asleep. So we just sit down and break it down to him and tell him that, we think he's going to pass away because this drug company, we're just not telling him that. But I'm sure that he can sense our anguish and frustration, and it's not good for him. I mean, I would much rather be at his bedside right now than here. This is a distraction from his care, and it frustrates me. I know we're bringing this on ourselves, but we are going to be asking until we get the drug.
And Elizabeth, do you think the drug company is going to change its mind, Elizabeth? Yeah,
You know what,
Elizabeth, do you think they'll change their mind?
I asked the president of the company that day, but I said, do you think that's a possibility? And he said, no, we are not changing our mind. He said it breaks his heart. He's devastated. And I said to the president of the company, how will you feel if Josh passes away? And he said, I will feel horrible, but I will have known that I made the right decision for other patients.
All right. Well, we are praying for Josh. Amy Hardy, thank you so much for joining us. Elizabeth Cohen, thank you as always as well.
Could I ask everyone to just pray for us and follow us on Save Josh on Facebook, and also they can see our Caring Bridge, caringbridge.org, Joshua Hardy. Thank you.
You bet, you bet. All right. We wish you the best of luck, and we wish Josh just a few happy days ahead. Thank you. Well, ahead here, of course.